Hello, my name is Danny Segura, and today I want to talk about the issues with the United States of America's healthcare crisis. First, I just want to start off with a question that if you or anyone that have maybe they don't have a healthcare insurance because they can't afford it, or maybe they can afford it but it requires a whole paycheck, so as well as their treatment being denied or delayed, you know, this is one of the issues that I see that are the biggest flaws in the healthcare system, like elephants in the room. Of course, there's still more issues, but these are the main three topics I want to talk about. I want to talk about the price, enormous price, inequality, and how low income adults can afford. And at the end, I want to bring light to it, to these problems, and bring a solution to it. That's the most that I could do. It might not solve everything, but I want to make it better as than how it is now. Now, first part, we have to analyze what is the problem with the healthcare system. First of all, with the healthcare system, I want to start off with the high price, the very very high price, elephant in the room. You know, uh, in an article, a Harvard study, the enormous high price, bro, that most patients they don't even ask about how this is gonna affect them. They ask how this is gonna affect them financially. They worried about going bankrupt and decide to just tough it out just because they can't afford it and because it requires the whole paycheck. You know, that's one of the biggest problems that the United States have, because I feel like this problem came from just the United States profiting technology over people. Because I noticed that we're starting to advance more in technology, but the United States, the problem what they haven't joined the world's medicine drug trade. They make their own medicine and everything, which is why most things are like a high price, you know. Um, and of course, there's things that are not enough, which is why health insurance can come into play. But then again, that's also not enough because that also causes money, and low income adults can't even benefit from it. So there is so much issues with it that is kind of layered, that you have to fix one problem, but there's another problem that's affecting it, and then there's another problem affecting this one, and then another one, and another one, and another one. It just keeps on going. So, you know, and another problem that I want to talk about, the inequality towards people. I noticed that people online, blogs, and all that, they talk about how their treatments take so long, like to the point they're delayed for weeks, months, days. Max, like that's the least, days, maybe days, and you know, and when you compare with these people, compare with them famous people, rich people, or any other important people, you notice that they mostly get their treatments like right away. They get the appointment up ready on the dot. It's gotten so bad to the point where people have resorted to the ERs. And for that, that's just honestly crazy to me, because ERs are for people who are in life-threatening situations where they are injured or has any medical problems. Now, I just want to get to my second point to fix all of this. First of all, I want to get the big elephant in the room, the complexity of the U.S. healthcare system. This complexity is so just like burdensome, because one has to determine what coverage healthcare consumers are eligible for, which, for example, psychiatrists are in network, how much patients owe, and the deductibles and co-payments, and how to dispute inaccurate bills, and the little time that patients have to ensure that they are receiving the care they need. And psychiatrists, at this point, psychiatrists spend more time on administration than their counterparts in other countries. This makes it all expensive. This makes it, for example, let's just say everything that I just said. that could estimate up to more than $500 billion annually to a administrative cost of healthcare US. That's how complex the system is that is costing our country that much money because of the complexity of it. We could simplify the healthcare mostly in three areas by addressing the differing ways individuals in the US can get health insurance. Two, the complexity of insurance benefits design. And three, relationships among insurers, hospitals, and psychiatrists in the US. Now, one way we could narrow down to the insurance options to either employee or employer sponsored insurance or Medicare, and within Medicare allow for fee for service or managed care plan. This could reduce the myriad health insurance benefits designs. Most countries, they have some type of universal care coverage. They have limitations on, for example, services, copayments, balance billing, out-of-pocket expenses, network formation, etc., etc. You know, one example of a Dutch insurance companies all cover the same basic benefits and all have the same minimum deductibles with exemptions for primary care provider visits. The only variance is in the premiums, supplement coverage, and etc. etc. Then the psychiatricians, hospital networks. Thus, patient's choice is primarily focused on the few features is simple. We need to further reduce plan variability and define a few plans with standardized benefits, copay and deductible levels, drug benefits, and other parameters to reduce employer and employee cost, as well as to facilitate better insurance options for both people. And I think, and another way, like for my other point, to simplify what occurs at doctors' offices and hospitals and other healthcare facilities, they give out like endless paper registration forms that are filled out by hand, recording medical problems, emergency contracts, etc. In the digital era, this is all like a waste of time, and I think the government should mandate all psychiatrists, urgent care centers, hospitals, and other type of providers offer digital registration by card or any other identification which links to the insurance eligibilities, benefits, etc., etc. This will make such an easier time for patients to know what they're getting for their insurance. This makes it so much better, as in a process such as, authorization, simplifying what the psychiatrist might order, and the electronic health record systems, and rapidly shifting to alternative payment models where you could just pay and then just that's it. And, with that out the way of the complexity of the United States, the second area I want to talk about is needing to change is emphasizing and increasing reimbursements for primary care. The US has way too many adult focused specialists who are reimbursed very highly. Specialists also expend more resources than primary care physicians when when treating with similar conditions. Strong primary care systems enhance performance. The Netherlands, Norway, and the United Kingdom have strong primary care models in which primary care psychiatricians assume responsibility for more services than their US counterparts, and nurse practitioners and mental health nurses deal with the patient of quality life and counseling issues. Primary care cooperatives provide extensive amount of triaging, so patients use emergency department less. Patients are also penalized for going directly to specialists without referrals. Me, for example, I have to wait months just to go to an ear specialist because I had a concussion in the gym and my eardrum was actually ruptured. But for that time being, I had to tough it out because my primary care wouldn't refer to me in time. It took them months. Like I didn't even need that referral no more. And that's one of the problems that I want to address too. Without referrals, everything's expensive, you know, and we should definitely emphasize on referring patients who need the specialists because a lot of times I feel like people would tough it out when it goes on for months and months. And I don't think you should be able to tough it out. Like, for example, maybe a disease that you have, a condition, or, just anything. Because this made me go in a lot of pain for 3 whole weeks of ringing in my ear. And I just had to tough that out for 3 weeks, which is dumb because that was the worst time of my life. No, the government really needs these regular regulations and process it into place to have a better healthcare system in the world. And another way that they can improve their healthcare system, by changing the price. All right, here's the big part: the enormous high pricing. There's the hospital bills. We already got that covered. We got the health insurance. They now we got that problem out the way. But then there's the drugs. The drugs are so high. I remember when my mom had to buy drugs like prescribed pills for me. It was almost $200. That is expensive for 2 little capsules of drugs. And that problem, that could be addressed because what I found out that the United States is actually not in the drug trade world. So this whole time, they could have been the drug trading business. Could have been a lot cheaper because I'm pretty sure my mom did not want to spend 200 bottles on some 2 tiny pill bottles. And yeah, that's all I got today for this podcast. I really just wanted to bring out some light towards this, to the inequality that people receive, like me and low income adults. I just wish nobody has to come up to the point where they need an emergency and their life is now gone because they didn't get their treatment in time, or it was denied because they didn't have enough money, or it was just because, of the inequality that hospitals have towards low income people. And the solutions, I hope the United States government either makes a brand new system or hopefully just act on it and address the issues with it to making it cheaper for the people, not just for me, for everybody, for low income adults that can't benefit from health insurance or the health care because the US likes to place profit over people. And which is why that's why I talked about in this podcast today. So thank you for coming by, and I'll see y'all later.